When the COVID-19 pandemic began, it wasn't hard to predict that incarcerated people would be at higher risk. Many prisons and jails are crowded, dirty places with inconsistent access to healthcare, breeding grounds for the highly infectious virus. But the job of documenting the deaths has fallen to a patchwork of research groups and reporters. Now, a national study from one of these collaborations, between the University of California, Irvine and Brigham and Women's Hospital, shows that at the peak of the pandemic in 2020, people inside prisons died almost 3.5 times more frequently than the free population. More than 6,000 incarcerated people died in the first year of the pandemic, researchers found, using numbers they collected from state prison systems and the Federal Bureau of Prisons. A Marshall Project analysis of data the researchers released shows that the overall prison mortality rate spiked at least 50%, and potentially exceeded 75%, with roughly 50 or more people dying per 10,000 in prison in 2020. The virus hit older generations especially hard. In the 8 states that shared age data, death rates for people aged 50 and older rose far higher than for others, reaffirming how much more vulnerable older prisoners are, said the study's lead author, Naomi Sugi. At the same time, incarceration rates dropped during the first year of the pandemic, but not because an extraordinary number of people were released. Despite a range of advocates calling for releases, particularly for older adults, who have higher health risks and statistically lower chances of committing a crime, data shows that fewer people than in a typical year were let out in 2020. Instead, there was a dramatic reduction in prison admissions. The slowdown in admissions meant that prison systems reduced the number of younger people exposed to COVID. That's because incarcerated people are generally older than those likely to be sent to prison. By the end of 2020, Bureau of Justice Statistics data shows, the number of people in state prisons under 55 fell by 17%, while the 55 and older population was down by 6%. States and the federal government have legal tools to release at least some people, but rarely use them during the most urgent phase of the pandemic. In most states, only the governor and parole board can release people from prison without a court order. Most state constitutions allow for governors to issue a pause in a criminal sentence, known as a reprieve, as well as commutations, which let them shorten sentences and free people without post-release supervision or expectation that they return. No state governors used either power for large-scale releases during the COVID-19 emergency, and only a small number performed any at all. Rachel Barco, a law professor at New York University, called the lack of action a naked political calculation, tied to concerns that even a single high-profile crime by someone who was released could turn into a media firestorm. Most people let out from state prisons due to COVID-19 were released by parole boards. In Iowa, the parole board held more hearings and released slightly more people in 2020 than in 2019. The state's Department of Corrections said that administrative changes allowed them to assess parole cases at a higher volume. Department spokesperson Zach Carlisle said that in the years that followed, the rate at which people who were released committed new crimes went down.